I'm Ellen O, Director of Interdisciplinary Arts Programs at Stanford, and host of Art And, where we explore how artists and scientists are shaping new ways of seeing the world. Today, I'm joined by Dr. Anita Mohan, a plastic surgeon at Stanford Medicine, and Lauren Toomer, an artist and lecturer in Stanford's Art and Art History Department. The two first connected through a medical humanities fellowship. And what began as a mentorship has grown into a true collaboration that brings art and medicine into dialogue. Together, they're hosting workshops that invite med students to slow down, observe, and see the body through an artist's eye. Here's our conversation with Anita and Lauren. So Lauren, you have been working at this intersection of art and medicine for a long time. But how did you get into this cross-sector space initially?
As an undergrad, I took a course called Art, Medicine, and Disability. And that really opened up my mind in terms of thinking about art and thinking about the body and thinking about just the world around us in a more holistic way. And the fact that we can integrate these various topics. I was always interested in it as a child, learning how to draw in terms of looking at all the greats of Da Vinci and Michelangelo. But to see another female in that space who is, doing incredible work, that was very inspiring. And that class definitely left an impression on me. And I knew in my career that was something that I wanted to explore because I saw the beauty that it gave to me in terms of knowledge and looking at the world differently, that was a pathway that I want to go down.
Ever since you came to Stanford for your MFA, were you from the start, were you interested in connecting with the medical school and thinking about anatomy in your work?
Most definitely. I remember my interview with my, the panel of, faculty. And they were saying, what are you interested in? What are you wanting to do? And I remember one of the first words that came out of my mouth was this idea of dissection and really learning the body from the inside out, which you can imagine with many artists, probably much different with Dr. Mohan in terms of that's normal conversation. But when you bring it into the art spectrum, it can be you want to do what? And I was very thankful that they embraced that curiosity. And I was able to engage and take coursework through the School of Medicine with a major focus on anatomy. So I came in tunnel vision. That's one reason I chose Stanford. It's like no other in terms of these abilities to collaborate, as well as to engage with so many different types of minds and disciplines. So,
how did you connect through the fellowship? Can you tell me a little bit more about that program?
Well, this was my first time in the program, so I signed up as it sounded an exciting way to have a break from the daily clinical activity that we do, engage with others, and also just reflect and engage in activities that I've enjoyed. And the majority of the program was focused on writing, but it talked about podcasts and art, and I thought I'd love to just reconnect with that sort of talent explorer. I've done sort of some workshops in the past, and I find it such a great relief and just a way to just focus my brain, just have in a different landscape. And through that program, as I had an interest in producing a form of art or piece, I wasn't quite sure. It was the directors of the program who connected me with Lauren. I was very lucky and then in our first sort of interaction, I already had my ADHD and was going on having all these either ideas and spin-offs in the back of my mind, along with discussion of our, sort of capstone project, which she was guiding me through.
That's amazing. Art can really do that. It gets you spinning in all kinds of different directions. But Lauren, can you tell us more? I guess you're probably more familiar with the program, and it's run through medical humanities.
I love what Anita mentioned about the fact in terms of physicians, they have so much going on, and then how can art help to balance out or maybe teach them to have moments of pause, right? And this opportunity for physicians to engage in this way with the arts, which they span many different types. Some of them are more from the writing perspectives. Others are more related to more media. And the ultimate goal is just to give them a chance to have more of a sense to kind of be within their own thoughts, to channel those through an artistic means, and then produce a final outcome. And in Anita's case, it was incredible, dare I say, narrative drawing, painting hybrid. So.
Okay, so I'm curious now to hear from Anita a little bit more about what that final project looked like.
The theme of it actually was inspired by friends of mine who've had breast cancer and their breast cancer journey. We manage a lot of patients with breast cancer. My PhD and background research was in breast cancer. And so that patient journey, and then specifically my friend's journey and things that we just talk about had inspired me. And I wanted to see how I could kind of portray some of the emotions she was going through. So I was using sort of color and more abstract sort of form and sort of a picture. So it was the consultation, the operating room, and the after. That was kind of the three themes. And then actually my friend, she started doing spoken word for some of her expression of her journey. So she actually also created a spoken word that went with each of those scenes. So I felt like that was a beautiful way to connect and explore and empathize and just get a sort of a deeper understanding beyond just our clinical conversation of what patients are feeling and going through.
Did you say that you had experience doing drawing and sketching prior to this fellowship?
Mm-hmm. Yeah.
And what role did the mentorship, what role did Lauren play in the development of the project?
She would send me sort of examples of artists and ideas and abstraction and trying to explore different things that I have never come across or thought about before, which was very exciting. And then trying to guide me in some of my thoughts and things to try and practice with and play around with. And then the use of kind of creating some sort of collage, which is type of sort of scenario as well.
Stepping into that world is not always easy, and like finding the connections between these two fields is not always clear. I want to talk a little bit more about what that felt like for both of you, kind of stepping into each other's worlds. I know that, Lauren, you said that scientists often claim that they're not artists, but you notice artistry in things like the way cells move through the body. And how can you, or how do you encourage students and colleagues to shift their perspective and see that artistry?
I recently was working with, an incoming graduate student or PhD student in genetics. And they were hesitant to do this painting activity that I had set up for them. And they said the famous, "I can't draw, I can't paint, what do you want me to do?" And I was like, "Don't worry." I honestly told them, like, the worse the better. I sometimes feel like if we're overeducated, it actually influences the work in a negative way, because art at its best is play. And it's kind of going into that deeper mindset of curiosity. And so they started talking to me about the process they were working on. And that's where the schematic came up. And I said, just paint a schematic, like it'll naturally become. And so as they started to do that, they did start to engage with the lines and the dots and the dashes, even though they represent something, just like mini abstract art does too. But in some ways, abstraction can feel very uncomfortable, because I think you have to go deeper within yourself. And that's where my more curiosity as an artist, comes in. And I try to have those conversations with them of like letting their mind wander, because everyone wants like point A to point B. And life doesn't work like that. Science doesn't work like that. Art doesn't work like that. So I think art teaches them, I hope so, in that sense, to be a little bit more fluid in their approach to it, and that they can do it. I'm like, they did it. I'm like, you made a schematic, or, you made a mark. Or I say, you do your signature all the time. That's an expression of who you are, right? So it's all linked.
So Anita, in plastic surgery, you deal with concepts like beauty and proportion and negative space every day. But how does thinking about those ideas through an artistic lens affect the way you practice medicine?
There's the functional component of what we do for cancer and trauma reconstruction. But then at the same time, the survivorship goes beyond that initial injury and recovery, and maybe for many years beyond. And therefore, as we are getting, more advanced in our techniques, we have to think about that form, and all of these things can be and trying to get a patient back to a sense of feeling normal, or feeling functional, or feeling, they haven't lost something, and feeling whole so they can continue to function and survive, and live with that. And so it's very interesting. You have very different conversations with patients. And then in terms of reconstruction, you're thinking, oh, maybe it's not just reconstruction, even for cosmetic, there's surgery, and sometimes it's a combination of both. There's different trends, there's different expectations of what a patient thinks is their ideal, which is same in society. So in terms of proportion or size, or, and they might want what my opinion is, but what age group, generation, society, that has evolved as well over time, of what patients' expectations may be, what public perceptions and expectations may be. And so having that conversation is really important. And trying to engage to understand from the patient's perspective, I feel is a really important part of our initial consultation. And then there's I like plastic surgery because there's that artistic element. Patients laugh at me because I'm drawing all over them and with a marking pen, and like there's all these lines, and I'm trying to create a mental picture in my head of how things are going to be. So I guess that's I get to express my creative element, although I find it hard with the marking pens drawing on people, and I wonder how those body painters do those amazing jobs when I see those competitive TV shows. I probably need some more lessons on that. Yeah, I feel like plastic surgery is very special in that way. It sort of helps incorporate sort of a vision and 3D, sort of form and beauty.
I want to talk a little bit about this new project that you're embarking on together with funding from our office, through our Burt McMurtry Arts Initiatives Fund. You're developing a pilot workshop that's framed around the aesthetics of the body. Can you talk a little bit about the design of the workshop and what made you want to or come to this idea?
I feel that in terms of what Anita just spoke to, in terms of thinking about the body, lines, contour, and shape, just hearing her talk right now, I'm like even more inspired to like get it going and to start it, because those are the same. We notice just the similarities, right, between the art of looking as a plastic surgeon and then the art of looking as an artist, and how might utilizing visual arts as a means or mode to honing skills that then can be applied to medicine. So, for example, in the same way that, Anita works with a patient, we'll have a figure model. So that's one aspect of it. And it's like, what is the way that one looks at a model, and they're nude modeling, right? So you have to deal with these ideas of aesthetics, or even from the artist's perspective, of feeling like, oh, am I capturing it right? And those kind of feelings of doubt that Anita just spoke to in terms of sometimes what her patients feel. So in some ways, the artist is able to empathize just by going within themselves, hopefully through this workshop, and taking the elements of drawing, but also sculpture, how you mentioned too with Anita, because there's a sculptural component to it. So they'll also have a chance to engage and think about the various layers of the body. But I think it's equally as equally as much about the person who's creating it within themselves as like the final outcome in the environment that it's around. So,
as a plastic surgeon, we think about anatomy and we have different ways that we analyze it medically. And then it's then wonderful to then incorporate, the experience of, how I mentioned about sort of beauty, and then with the history of sort of art and how art has been perceived in society, and even in pieces from different times, and even social media, and sort of culturally how it can be very different. And so helping to explore those and reflect and review those from different perspectives, I think will be provide a holistic way to analyze the body and analyze anatomy. With the morning session, the focus was to be on head and neck, so the face essentially, and facial beauty and aesthetics, and with a sort of clay sort of sculpture opportunity to get some creative juices going from the participants. And as Lauren mentioned, in the afternoon, we'll have a live nude model and focus on breast and body, or breast and trunk.
What are your hopes and goals for what the medical students and residents will take away from the workshop? And how do you hope that it will change their practice or approach in any way?
I would hope, my hope is some fun and engagement, and that reflective process where I feel, as Lauren mentioned, just, you can get so caught up in how we're doing things and deadlines and deadlines and the process has to be perfect, whereas this is a way where it does not, and be able to explore in a relaxed environment, but also just to be able to think outside the box, to reflect on some things that are outside this, outside of what we're doing day to day. I feel like I'm probably going to get a lot out of it myself, and from the development and the process too. So, and learn so much. But in terms of just anatomy, just in terms of just thinking, maybe it's more like how people think and observe and look. I think as you mentioned, that art of observation, maybe that will be it. Just that art of observing and then translating that into some creative piece. Hopefully it will be something that they will be able to get from it.
Lauren, you've talked about empathy and staying curious. Are those some of the outcomes that you're hoping to see?
Yeah, yes. Curiosity and empathy are definitely, I think, great grounding places. I have to admit, I always tell my students, I don't know if it's a good thing or bad thing, but I think it's spot on. I say if they leave the class, like, sure, they'll learn technique and all of that, but if they go outside and they like, oh my God, like I see the shadow, like it's a cast shadow, it's a core shadow, it's a reflective light. To me, that's a win, because that's shown me that they are attuned to what's around them, not just in the moment, but in their day-to-day lives. And that will then translate over to whatever discipline that they choose to go to specifically for this particular workshop. Maybe they're spotting something in a patient that might have gone unnoticed, or the subtleties of the importance of that this person brings a full story and a full life to the room. And as artists, we have to try to express that or emote that through our visual arts or visual means of like really tuning in. So as Dr. Mohan mentioned about like, we'll look at the facial expressions, but it's also like so much deeper. I was mentioning that sometimes I'm sure we all are guilty of like, we smile. They like smile. And I was like, But when it's a real smile, and when the person is performing. And so to pick up on those nuances and then maybe even be able to express that, I think is a win in terms of the empathy part, and remaining curious and aware of what's around you. So
what's next for the workshop after the pilot? And what's your bigger vision for art in medical education?
I'm excited to work with Lauren and build this and develop it. And I'm sure from it we'll have more ideas and applications. In my field, I would love to be able to do the workshop in collaboration with, for example, our California Plastic Surgery Society, for example, and to engage like students, residents, and faculty and nursing staff, and and open it up for people to be able to just engage in this kind of form and experience as well.
Even to look at it from the science perspective, I think it also gives encouragement to like when people who are not in this realm to be like, oh, maybe I can't step into this. There's like a resident doing this, like there's medical students doing this, there's an incredible physician who's part of it. Maybe this is not outside of my place of comfort, right? Or that I can, or maybe it's okay to step outside your place of comfort because it creates a much more broader picture of possibilities. Which I think our collaboration here points to in terms of me, like as a visual artist and a plastic surgeon. It sounds like the start of a sitcom, but it's like it births so much richness in terms of possibilities. So I hope many more people, even outside of the scope of even medicine, find this to be something that they can gain from.
So in addition to just being willing to try something new and take that risk, what advice would you give other doctors or artists who want to build this kind of bridge between fields?
I mean, I would say have no fear. You can only ask. I had been thinking about something like this for a little while, and it's how do I engage? How can I find someone? How do I get it set up? And I didn't know. So it was always in the back of my mind, and through through serendipity and through this process of, yes, okay, I'll sign up to the Medical Humanities Fellowship. Not sure what I'm getting myself into. And then allowing myself to go on this journey, that has given me this opportunity. So just to have the courage to take a step and explore, especially I think when people have an interest or that curiosity, and not to be scared about having that curiosity. Many things can open, and it might not be directly related to what you do, but there might be something that can then translate into whatever you do.
I think we think about art with a capital A, and we think about medicine with a capital M in terms of who has access to it. But I always tell people that if just doodling is a form of art, it's even shown to help you remember things better. So I always encourage people just in terms of starting to think about them more as visual diaries, that they're for themselves. You don't even have to share it with someone else, that those become kind of treasures. And then throughout the day, even if you do one small thing, to look back at that, they speak to that moment when you created it. So I think remaining open, I think, as we mentioned before, stepping outside of your comfort zone, which is hard to do. Like, I think we talk a lot about like, oh, interdisciplinary, step outside your comfort zone, blah, 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 blah. But to actually do it, it does take courage, and it takes, courage. I think courage is the best word, and a willingness to try. So I think start small, because sometimes if it's too big, it feels too overwhelming.
If you had to leave listeners with just one idea about what art can offer medicine or what medicine can offer art, what would that be?
Again, as an artist that came into medicine, I think the obvious would be that I got more interested in the technical side of it. But I would say for both aspects, it's more of like an illumination from within, that it kind of opened things up in a really kind of flowered way that in some ways led me maybe more towards appreciating abstraction. So in terms of what artists can gain from medicine and medicine can gain from art, I think it's more of in many ways, a sense of yourself that then allows you to appreciate others in a more meaningful way. I know it sounds very kind of like, oh, but I think I would be remiss if I didn't mention that, and you must know, I think I might have mentioned this to you, Anita, that anyone listening, I hope this part makes it, is that they need to Google the sphenoid, because it looks like a butterfly. and is one of the most beautiful bones in the human body. And no one knows it. Even some physicians are like, what is that? Is that the pelvis? And I'm like, no, it's behind your eyes. It's supporting your brain. It looks like a butterfly, and it's called a sphenoid, because it's a wedge-shaped bone in your head. And it looks like a creature, or the most angelic, like beautiful winged creature. And if everyone realized they had a butterfly in their head, that to me, that's it. Like, that's for any aspect. That's it. That's the sphenoid, butterfly in your head. That's it.
I'm totally going to Google that.
I think I would have loved, Lauren, for you to be there in anatomy class. Like in my anatomy classes, because we have like the book and we have like, here are the muscles, this is what you got to dissect, etc. And these visual representations that you present, I have never looked and thought about the sphenoid like a butterfly. And I wonder what you think of, like, I don't know, the cochlea, like, or something like that. Exactly. And I know Ellen, you might be Googling all these now.
I have no idea what that is either. Well, thank you both so much for taking the time today.